If you find yourself pushing up from your knees with your hands, it's not just getting older. That's a signal you shouldn't ignore. Have you noticed that after turning 60, your legs feel like they've turned to jelly? Getting up from a chair now requires a push with your hands. The stairs feel like Everest. Sometimes, just walking from the room to the kitchen makes me feel unsteady. It seems like it's normal. Well, it's just age. But the truth is much more dangerous. This could be sarcopenia, the age-related loss of muscle mass. It doesn't hurt, doesn't cause any obvious symptoms, and that makes it even more frightening. It creeps up quietly, and then you find you can't stand up without support. What's alarming is that by the age of 70, a person can lose up to 30% of their leg muscle mass without even noticing it. But there's good news. A new study has shown that just 3 inexpensive vitamins can significantly restore leg strength in just a few days, even without exercise. No injections, no gym required. Just eat healthily, and you'll be getting up from your chair effortlessly again. In this video, I will talk about 3 vitamins that are particularly important for older adults. I will explain why a deficiency in these vitamins can lead to weak and heavy legs, and how to properly combine them to feel the effects more quickly. Everything I'll discuss has been backed by clinical studies and the experience of medical professionals. At the end of the video, I'll share a vitamin regimen that not many people are aware of, but it really works. Your body will start to change, and you'll notice the difference. After the age of 60, bones become more fragile and circulation slows down, which is why it's so important to take care of your body. As we age, our muscles weaken, and this is especially noticeable in the legs. Many people aren't even aware that it's the legs that are the first to lose strength, making it difficult to stand up or walk. Even if you eat normally and feel fine after the age of 60, you lose about 1 to 3% of muscle mass each year, according to the American Geriatric Society. In just 5 years, you might not even notice that your legs have become 15% weaker. Why does this happen? There are several reasons why our legs become weaker as we age. First, the body starts to absorb vitamins less effectively. Food is not digested as well, the stomach produces less acid, which results in lower levels of vitamins such as D and B12. These vitamins are crucial for the proper functioning of muscles and the nervous system. The second reason is poor circulation. Blood flow slows down, resulting in the legs receiving less oxygen and nutrients. As a result, they get tired more quickly and may experience cramps, heaviness, and weakness. Another factor is a sedentary lifestyle. As we age, we tend to move less and avoid stairs and long walks, which leads to a gradual weakening and shrinking of our leg muscles. Even if you strive to stay active, without enough vitamins, your muscles won't be able to fully recover. But there's good news. If you can replenish just 3 essential vitamins, you can significantly restore your leg strength in just a few days. Let's take a closer look at which vitamins are truly necessary and how they affect us. Let's start with something that often gets overlooked by older adults, vitamin D3. Its role is far more significant than just being a dietary supplement. You might not know this, but this vitamin acts like a master switch for the nervous, skeletal, and muscular systems in the body. As we age, especially after 60, our bodies struggle more with producing vitamin D3. The skin becomes thinner, the liver and kidneys work less efficiently, and we spend less time in the sun than we used to. As a result, important systems start to function less effectively, muscles weaken, legs feel heavy, and movements become slower. The most unpleasant thing is that we start to feel unstable and often lose our balance. These are all consequences of a deficiency in vitamin D3, which is essential for our bodies. Why is it so important? Vitamin D helps the body absorb calcium, and without calcium, bones can become brittle and weak. But his work doesn't end there. Vitamin D3 is essential for our bodies to function properly, as it helps with muscle function and the transmission of nerve signals. It helps slow down the loss of muscle mass that everyone experiences as they age. When this vitamin is lacking, a person becomes weak and tires quickly, as if all their energy has vanished. How can you tell if you're lacking vitamin D3? Listen to your body. Do you often experience weakness in your legs, especially when you need to climb stairs? Do you often find yourself getting tired quickly, even just from walking or standing? Are you troubled by nighttime leg cramps or experiencing pain in your hips, knees, or heels? Is it difficult to make sudden movements or turn around? Sometimes these symptoms are accompanied by irritability, anxiety, and sleep problems. Many attribute these feelings to aging, but more often than not, they are the first signs of a vitamin D3 deficiency. Researchers from Birmingham conducted a study on individuals over 65 and found that after just 5 days of taking vitamin D3, the participants' leg strength increased by nearly 20%. Within just a few weeks, elderly individuals who took supplements and engaged in some physical activity experienced stronger muscles and improved balance. Similar results were also observed by Chinese specialists. Researchers at Harvard found that elderly people with low levels of vitamin D3 had a 40% higher risk of falls and hospitalizations compared to those with sufficient levels of the vitamin. The conclusion is clear. No visual object. Prompt not required. Vitamin D3 is essential not just for strong bones, it also helps us stay active and independent for longer. Thanks to D3, the body absorbs calcium more effectively, muscles become stronger and work more harmoniously, making movements easier and more fluid. It also reduces hidden inflammation in the tissues, which means that joints and muscles experience less pain and function as they should. People over 60 are typically advised to take between 800 to 1,000 international units of vitamin D3 each day. If there have been instances of falls or signs of muscle weakness, the dosage is increased to 1,500 to 2,000 units. For better absorption of the vitamin, it is recommended to take it in the morning or during the day after a meal that includes healthy fats, such as fish, eggs, or olive oil. It's not recommended to take vitamin D3 at night, as it may interfere with falling asleep. It can be quite challenging to get the required amount of vitamin D3 solely from food, which is why many people often need to take it as a supplement. Let's take a look at the numbers. In 100 grams of fish, there are approximately 500 international units of vitamin D. One egg contains only 40 units, while a glass of fortified milk has about 100. For most elderly people, it's challenging to eat enough fish and eggs every day and drink enough milk to get the necessary nutrients solely from food. That's why many people often need to take vitamin D3 supplements. It's particularly important for those over 60 to consider supplements, especially if they rarely get outside in the sun, experience feelings of unsteadiness, have fallen before, suffer from osteoporosis or joint pain, or follow a plant-based diet with little to no dairy or fish in their meals. Vitamin D3 becomes really important in such cases. There are a few key points to keep in mind. Overall, vitamin D3 is considered safe, but taking too much for an extended period can be harmful. If you take more than 4,000 international units of vitamin D per day, you may experience headaches, constipation, nausea, and the formation of kidney stones due to excessive calcium intake. In some individuals, this can even lead to heart rhythm disorders. That's why it's important to follow the correct dosage, take the vitamin at the right time, and periodically check its levels in the body. Vitamin D3 is especially important for older adults. It helps restore strength to their legs. As we age, our muscles tend to weaken, but this vitamin can help revive them. When taken correctly, you may start to notice a difference in just a few days. Your legs feel stronger, your stride more confident, and you'll experience increased lightness and stability. Vitamin 12 is also important. It helps restore balance, supports nervous system health, and boosts confidence in movement. Despite its significance, people over the age of 60 often underestimate this vitamin. Meanwhile, B12 is essential for memory and energy, although not everyone is aware of this. It is necessary for the brain and muscles, especially in the legs, to function well together. Thanks to 12, the nerves remain healthy, movements become more precise, and reactions quicker. When there is a deficiency of vitamin 12 in the body, the connection between the brain and muscles is disrupted, and this often first impacts the legs. You may experience a burning sensation, tingling, or numbness in your feet. Your legs may feel weak, especially when standing or walking. Sometimes it feels like my legs aren't responding, as if they're numb. It can be challenging to maintain balance even on a flat surface, leading to uncertainty while walking, and sometimes I need support. All of this indicates that the 12 level is low. Another possible sign of deficiency includes mood swings, mild sadness, forgetfulness, and a feeling of mental fog. These symptoms usually develop gradually. Many elderly people mistake them for normal age-related changes, but in reality, they are often linked to a deficiency in vitamin B12. Older adults often experience a deficiency in vitamin B12, and there are several reasons for this. As people age, their stomachs produce less acid, and if they are also taking medications to reduce acidity, such as ranitidine or omeprazole, it becomes even more challenging to absorb vitamin B12 from food. Additionally, vitamin B12 is primarily found in animal-based foods such as meat, fish, eggs, and dairy products. People who rarely eat meat or follow a plant-based diet are at risk of experiencing a deficiency in this vitamin. Even if your overall diet is balanced, as you age, it becomes harder for your body to absorb and utilize vitamin B12. Research shows that a deficiency of this vitamin negatively impacts the mobility of older adults. For example, researchers from Oxford found that individuals over 65 with low levels of B12 are more likely to experience balance issues, slower walking speeds, and a twofold increased risk of falls compared to those with normal vitamin levels. In one study, elderly participants were given vitamin B12 for 8 weeks to examine its effects on health. After completing the course, many noticed that they felt better, numbness decreased, their legs became stronger, they had greater stability, and their reaction times improved. Vitamin 12 not only helps with clearer thinking but also supports coordination and overall well-being. It plays a crucial role in the body. It helps form the protective sheath for nerves, aids in the production of red blood cells, supplies muscles with oxygen and energy, and ensures quick and accurate transmission of signals from the brain to the muscles. As a result, the muscles function properly and respond more effectively. A deficiency in vitamin B12 can lead to issues with the nervous system. Muscles may not respond as well to signals, and there can be a sensation that the legs aren't obeying. Vitamin B12 deficiency is most commonly found in people over the age of 60. People at risk also include those who frequently take medications to reduce stomach acidity, follow a vegetarian or low-meat diet, use metformin for diabetes, suffer from gastrointestinal issues such as gastritis or irritable bowel syndrome, often consume alcohol, or have undergone surgery on the stomach or intestines. If you identify with any of these categories, it's worth checking your vitamin B12 levels in your blood, as a deficiency often goes unnoticed for a long time. Not everyone with a B12 deficiency shows obvious symptoms. Sometimes there is no numbness or tingling. Sometimes a person might suddenly start moving awkwardly, frequently dropping things, complaining of mild headaches, or feeling fatigued even after resting. You may experience unusual sensations in your legs, sometimes pain, sometimes tingling, or even a feeling that something is vibrating. These are signals from your body that you should pay attention to. The earlier you notice these symptoms, the easier it will be to restore your health. For individuals over 60, a safe and effective dose of methylcobalamin is considered to be 500 to 1,000 micrograms per day. Methylcobalamin is the active form of vitamin B12 that the body can use right away without any additional conversions. This is especially important for older adults, as it becomes more challenging to absorb vitamins with age. Vitamin 12 comes in various forms: chewable tablets, sprays, lozenges, or sublingual drops. It's best to take it in the morning or during the day, as coffee and tea can interfere with its absorption. Is it possible to get the entire daily requirement of vitamin B12 solely from food? In theory, yes, but in practice, not everyone can achieve this. For example, 85 grams of beef liver contains about 70 micrograms of vitamin B12, while the same amount of salmon has roughly 4.5 micrograms. One large egg contains just half a microgram, while a glass of milk has about 1 microgram. To get the required amount of vitamins solely from regular food, one would have to eat a lot of fish, liver, or dairy products every day. That's why for most elderly people, it's easier to take vitamins in the form of supplements. Excess B12 does not accumulate, it simply gets expelled from the body. If you have any questions, feel free to ask or share your experiences. Vitamin B12 is considered one of the safest vitamins, even when taken in large amounts. There have been no reported cases of serious overdose in healthy individuals. However, if you are taking blood-thinning medications or have chronic kidney disease, be sure to consult with your doctor before starting any supplements. For most people, vitamin B12 is a simple and effective way to boost energy levels, support the nervous system, and regain confidence in movement. Many seniors report that after they started taking this vitamin, they found it easier to walk, regained sensitivity in their legs, experienced improved balance, and enjoyed better sleep and overall well-being. Vitamin B12 is not only important for brain function, but also for coordination of movement. It helps establish a connection between the brain and the body, allowing muscles to respond faster and become stronger, while also restoring self-confidence. If you notice tingling, weakness in your limbs, or balance issues, it's important not to ignore these signals. Check your B12 levels. Your body may have been lacking this vitamin for a while. It plays a crucial role in combating fatigue and helps maintain muscle strength. You've probably heard that vitamin D3 helps strengthen muscles, while B12 is essential for the connection between nerves and leg muscles. But there's another important vitamin, thiamine, which is sometimes referred to as the bone vitamin. Thiamine is essential for our muscles as a source of energy for movement. To put it simply, vitamin D3 is like the light that turns on. B12 represents the wires carrying the signals, but without thiamine, this entire system just won't function. Even if your bones are strong and your nerves are in good shape, without thiamine, your body lacks energy. Thiamine plays a crucial role in energy metabolism. It helps convert food, especially carbohydrates, into ATP. This is a molecule that plays a crucial role in providing energy for every movement, breath, and muscle contraction. The leg muscles are the largest in our body, and it's especially important for them to receive all the essential nutrients they need. When bone density decreases, muscles tend to fatigue more quickly, become heavy, and recover poorly even after light exertion. All of this can be a sign of vitamin deficiencies that are essential for strong bones and proper muscle function. Many people over the age of 60 notice that their legs have become weaker and tire more easily, even with minimal activity. They often experience cramps, especially in their feet and calves. When walking, you may feel heaviness, and climbing stairs becomes more difficult, often accompanied by shortness of breath. After getting up from bed or a chair, you might experience dizziness or a sudden sense of fatigue. Additionally, some individuals experience a sense of mental fatigue. Often, appetite decreases and energy levels drop. These are signs that the metabolism in the muscles has slowed down. Often, the issue lies in the condition of the bones. Why do elderly people experience a decrease in bone density? There are several reasons. No specific object or action is required for the prompt. Firstly, as we age, our bodies find it harder to absorb essential nutrients from food, such as thiamine. Secondly, medications we take can also have an impact. Diuretics, which are often prescribed for heart issues or high blood pressure, can leach important minerals from the bones as they are excreted in urine. Certain medications, such as antibiotics or metformin, can also have an impact on bone health. Even drinking a little alcohol, like wine or beer, can negatively impact bone health. It's also important to consider our diet. Processed foods typically lack the nutrients essential for bone health, and if a diet is deficient in whole grains or legumes, the intake of these important elements decreases even further. In a study conducted in 2021 at the University of California, 300 elderly participants were involved. More than a third of them had decreased bone mass. This manifested as weakness in the legs, slower movements, and quick muscle fatigue. After participants were given supplements to strengthen their bones, most experienced an increase in energy levels, enabling them to walk longer distances and ascend stairs with greater ease. According to the journal Neurological Sciences, individuals who frequently felt fatigue in their legs were prescribed 100 milligrams of thiamine daily. After a week, 82% of participants reported an increase in their endurance, while 68% felt a reduction in heaviness and pain in their legs. There were no side effects during this time. Why is bone support so important for leg health? Bone vitamins help the body's primary energy process, the Krebs cycle, function more efficiently. As a result, muscles receive more energy, recover faster after workouts, and maintain strength and tone throughout the day for a longer period. Additionally, these vitamins enhance the transmission of nerve signals, particularly in the peripheral nerves that control the movement of the legs and feet. You can compare this to a car running on empty. If the gas tank isn't filled, it won't go, even if everything else is functioning properly. The same happens in the body when there's a deficiency of vitamin bone, or thiamine. Men typically require about 1.2 milligrams of thiamine per day, while women need around 1.1 milligrams. However, when elderly individuals experience nerve issues, weakness in their legs, or quick fatigue, doctors often prescribe significantly higher doses, ranging from 50 to 100 milligrams per day. Good news, this vitamin is water-soluble, so any excess is easily flushed out through urine. It's best to take bone in the morning to help you feel more energized throughout the day. Make sure to take it with food, especially if it contains healthy fats or protein. Avoid washing it down with alcohol, coffee, or black tea, as they can interfere with the absorption of the vitamin. You can get bone health benefits from your diet by paying close attention to what you eat. It's found in whole grains like brown rice and oatmeal, in legumes such as beans and lentils, in sunflower seeds, as well as in organ meats and pork. In practice, however, many older adults rarely consume such foods, and certain illnesses or medications can hinder vitamin absorption. Therefore, if you're unsure whether you're getting enough vitamins from your diet or often feel fatigued, it might be worth considering supplements. It is especially important for people with type 2 diabetes to pay attention to this vitamin. In this case, it's a good idea to check your bone thiamine levels or start taking it in a safe daily dosage. This is especially important for those who frequently consume alcohol, take diuretics, metformin, or medications to reduce stomach acidity. You should also pay attention to this if you experience fatigue in your legs even after light activity, or if you are losing weight or appetite without any obvious reasons. Is it safe to take thiamine? Yes, This vitamin is considered very safe, even in large doses, and is well suited for older adults. However, if you are taking any medications or have issues with your liver or kidneys, be sure to consult a doctor before starting high doses. Many older adults notice that just a few days after starting to take thiamine, they feel more energetic, their legs feel lighter, and it becomes easier to walk and climb stairs. The desire to move and be active comes back naturally. It's like a situation where fuel is finally added to an engine that has been idling for a long time. Vitamin B is talked about much less frequently than vitamins D3 or B12, and it is often undervalued. However, for older adults who complain of fatigue, muscle weakness, or heaviness in their legs, it can play a crucial role. Thanks to vitamin B, your muscles receive the energy they need, giving you more strength and motivation to take action. It helps you get through the day more easily and confidently. If you constantly feel tired, weighed down, or as if you're disconnected from your body, don't overlook even the simplest vitamins. Sometimes these can significantly improve how you feel. Now that we understand how vitamin D3, vitamin B12, and calcium, or other bone-supporting substances, contribute to muscle health and overall well-being, the question arises: what is the best way to take them together for maximum benefit? The answer is quite simple. The key is to choose the right timing. It's best to take vitamin D3 in the morning, after breakfast. It's especially beneficial if your breakfast includes foods with healthy fats, such as yogurt, eggs, or a little avocado. This way, vitamin D3 is better absorbed and provides more benefits. Vitamin B12 is also best taken in the first half of the day, for example, during or after lunch. This vitamin helps maintain energy levels, so if taken too late in the day, it can make it difficult to fall asleep. It's best not to take it with tea or coffee, as this can hinder its absorption. Don't complicate things for yourself. Just follow simple guidelines regarding the timing of your vitamin intake and how to combine them with food. Some drinks can indeed interfere with vitamin absorption. If you start your morning with a vitamin B supplement, take it with breakfast, especially if your meal includes whole grains and a bit of protein. For breakfast, you can have Greek yogurt, a boiled egg, take a vitamin D3 capsule, and a calcium tablet. For lunch, you could enjoy sautéed vegetables, baked salmon or tofu, along with a vitamin B12 tablet or lozenge. If you take multivitamins, make sure to pay attention to their ingredients. Some vitamins for seniors may lack essential nutrients. Make sure the formula contains vitamins B12 and D3, as they support bone health. Keep in mind that multivitamins include both water-soluble and fat-soluble vitamins, so it's best to take them with food like in the morning or at lunch, but not on an empty stomach. Don't assume that taking more vitamins will bring more benefits. Before starting any supplements, be sure to consult with your doctor or pharmacist, especially if you have chronic illnesses or are already taking medications. If you choose and take vitamins correctly, they can really help maintain your strength and energy. However, remember that moderation is key. Never increase the dosage on your own, especially if you're over 60. Don't assume that if a supplement or vitamin is natural, you can take it in any amount. That's not the case. A high dose won't speed up results, but it can easily cause harm. For example, vitamin D3 accumulates in the body because it is fat-soluble. If you regularly exceed the recommended amount, say, by taking more than 40 international units a day without a doctor's guidance, it can lead to an excess of calcium in the blood over time. As a result, kidney stones, constipation, nausea, and even confusion may occur. Those with kidney or liver issues should exercise particular caution. These organs eliminate excess vitamins, and if they aren't functioning properly, even a standard dose can lead to unpleasant consequences. So, if you have chronic kidney or liver conditions or any other serious diagnoses, be sure to consult with your doctor before starting any supplements, especially vitamin D3. It's important to remember that even vitamins can cause side effects. For instance, taking large doses of vitamin B6 for an extended period can lead to tingling or numbness in the hands and feet. Similar situations are rare, but most often problems arise when vitamins are taken without supervision, even before serious symptoms appear. If you take too much vitamin D3, you may experience headaches, muscle cramps, or a loss of appetite. That's why it's important to pay attention to how you feel and notice any small changes, especially if you've recently started taking a new vitamin. It's also helpful to get regular checkups from time to time. If you've been taking D3 or B12 for a long time, it's a good idea to get a routine blood test at least once every 6 months or once a year. This way, you'll know if everything is okay. You can check for any excess, as well as ensure that you're not deficient either. Vitamins can indeed help you feel better, especially as you age, but it's important to approach their use with caution. When used correctly, just a few of these substances can significantly impact your strength, mobility, and independence in daily life. In reality, it's not about age. There isn't a specific object or action, no prompt needed. If you're experiencing weakness, heaviness, or unsteadiness in your legs, you're not alone, and it's entirely possible to make a change. We've already discussed how vitamin B12 supports the nervous system and aids in coordination, while vitamin D3 strengthens bones and muscles. Additionally, B12 helps combat fatigue and maintain energy levels. Together, these vitamins can truly help you regain a sense of strength, confidence, and freedom of movement. It's important to remember, in order for something to change, you need to take the first step. This could be a routine blood test, adding vitamins to your morning routine, or consulting with a doctor. The key is not to procrastinate, but to take action. Have you had any experience taking these vitamins? No specific visual object, action required for the prompt. Have you noticed any changes, such as increased energy, strength, or improved balance? I'd love to hear about your experiences. Let's support each other and share what truly helps. Share your story in the comments. Your opinion means a lot to me. Thank you for watching this video.